Welcome back to the channel where medical topics are made simple. In this video, we're going to talk about how a blood clot travels from the legs to the lungs. In other words, how a deep vein thrombosis, or DVT, becomes a pulmonary embolism, or PE. People often wonder how a blood clot in the leg can cause a problem in the lungs. This video will show you step by step. You can find this topic in our book and follow along, which is linked down below. You can also find the notes for this video linked down below. When people talk about a blood clot in the leg, they're typically referring to a DVT. A DVT stands for deep vein thrombosis. A DVT is a blood clot that forms in a deep vein, typically in the leg. So we can see here we have a picture of the leg with the deep vein shown. If we zoom in on one of the deep veins, we can see a blood clot has formed in the vein. This is called a DVT. In our previous video, we talked about how DVTs form. We talked about Virchow's triad, which makes up 3 factors that increase the risk of blood clot formation, a process called thrombosis. These 3 factors make it more likely to get a blood clot. To learn more about how a DVT forms, make sure to watch the video on Virchow's triad. It's linked down below. Now that there's a blood clot in the leg called a DVT, how does the blood clot go from the leg to the lungs to cause a pulmonary embolism, or PE? As a quick reminder, a pulmonary embolism is when a blood clot or other substance travels to an artery in the lung and it blocks the artery. There are several causes to a pulmonary embolism, but a blood clot is the most common, especially a blood clot from the leg. So how does the blood clot get from the legs to the lungs? People often wonder how a problem in the leg can lead to a problem in the lung. Let's walk through this step by step. DVTs are most common in the deep veins of the legs. So how do they go from the legs to the lungs to cause a pulmonary embolism? Here's how. The blood clot in the leg can break loose from the deep vein and travel through the bloodstream. So after the blood clot breaks loose, it can then travel through the veins in the leg and then through the veins in the pelvis. The blood clot then enters the inferior vena cava, or IVC, where it travels to the heart. The IVC is the large vein that carries deoxygenated blood from the lower body back to the heart. Let's now zoom in on the heart. We can see the inferior vena cava at the bottom connecting to the right atrium of the heart labeled RA. So the blood clot that was traveling through the IVC enters the right atrium of the heart. The blood clot then travels from the right atrium through the tricuspid valve and enters the right ventricle. The heart pumps the blood clot from the right ventricle through the pulmonary valve into the main pulmonary artery. The main pulmonary artery and its branches deliver deoxygenated blood to the lungs to receive oxygen. So as the blood clot travels through the main pulmonary artery, it travels toward the lungs, where it becomes stuck in a smaller artery in the lung. This is known as a pulmonary embolism. When the blood clot is traveling through the bloodstream, this is known as an embolus. So an embolus is the traveling blood clot, and the embolism is the resulting obstruction or blockage. So now the blood clot is lodged in the arteries and the lungs. This will have pulmonary consequences, and it will have cardiovascular consequences. We talked about each consequence step by step in a previous video. To learn more about these pulmonary embolism effects, make sure to watch the video on pulmonary embolism linked down below. If you found the video useful, please hit that like button and let us know in the comments. You can find the notes for this video, along with our book and flashcards, linked down below. Subscribe to save time studying and not miss out on future videos and notes. Thanks for watching, and hope you return for future videos.